I am Meredith Hirsh.
And I'm Mike Chavez.
And this is Working Healthcare. Each week, we examine the inner workings of our American healthcare system because you can't fix what you don't understand. We talk with leaders on the front lines, behind the scenes, and everywhere in between to uncover what's broken, what's working, and what's next. Start with this. Up to 80% of the information patients get in an exam room is forgotten before they reach the parking lot. And that fog helps drive more than 1.5 million emergency department visits each year for medication-related injuries. Meanwhile, our national health bill is pushing $5 trillion and climbing. Families feel the strain most. Dementia caregivers spend about 31 hours a week coordinating care, and 70% say that paperwork and portal hopping is their top stressor. Our guest today decided enough was enough. Steve Lewis, yes, the same guy who once managed projects for Aerosmith, Rockapella, Lenny Kravitz, and Tony Hawk, the skateboarder, founded Nabu to turn that paper chase into one living, patient-controlled record. The spark was personal. When his daughter Bowe, yes, named after David Bowie, arrived at 34 weeks, Steve's family found themselves tracking every note, scan, and discharge summary just to keep her care on course. He built Nabu so no family has to juggle clipboards and binders again. Today, Nabu is in pilot use with clinicians and families across Australia. And Steve's wider mission is global. Unite scattered health data in one patient-controlled record and lift the hidden burden of managing care.
So today we'll explore three key areas: how a personal crisis became a platform where artificial intelligence can finally connect the dots, which if you're a regular listener of Working Healthcare, you know I'm all about AI, and why Steve still sees American incentives as healthcare's innovation engine.
So Steve Lewis, welcome to Working Healthcare.
Wow, what an introduction! Thank you so much. And I have to say, I'm really happy to be here. I'm really excited to have this chat. I love what you do. I love the challenging conversations you're completely unafraid to have from all sides of the spectrum. And thank you very much for having me on.
And it is our time a little after 4 p.m. and for you, it's a little after 6 a.m. So we might have Bowie run in and interrupt our interview.
It is a school morning, and yes, it is 6 a.m. I love to say that Australia is in the future, and I tease my niece and nephew that I'm calling from tomorrow. But and often it doesn't feel that way, and certainly in healthcare, it can often feel like we're in the past. But I think that anybody anywhere in the world can have that same feeling when they're on our side of the ratio. And yes, we might see a guest appearance from two teenage daughters who are waking up on a school morning, even though it's August.
They do things different on the Southern Hemisphere. So I really want to...
It's winter.
Yes, I know.
Wow.
So let's start at the beginning. What was the moment or experience that made you realize that there was a big problem in healthcare to solve? Because as a business person, I love the fact that you actually saw a problem and were trying to solve it as opposed to trying to find the problem, but you experienced the problem. What was that aha moment for you?
I think there's been a lot of aha moments along the way, but I think that often when you're in the middle of a situation, it's really hard to see a solution because you don't know what it is you're trying to achieve. And I think back to the stages of this journey, and there's the day one moment of, oh my God, I'm in this environment I don't understand. There was this building down the street that looked like, it said hospital on it. And you go there when you're sick, you go there when you've broken something, but you don't know all of the inner workings. I've never been in a neonatal intensive care unit. I've never seen an isolette and all of those monitors. And then all of a sudden, it's everything in your world. And so when people would say to me, Steve, you need to ask for help, Steve, you need to take a break. You think, I'm in this new world. I don't even know what I'm doing. So how am I supposed to do those things? It didn't come until much later in the journey when you see some families doing things that you think, okay, I wish I had that in my world. And you see some families get benefits and you think, well, how do I get those benefits? I'm in the exact same situation. How do they know that? How do I not know that? And for me, it wasn't until I had been running a technology company I founded. I was in a remote part of Australia and I was using these tools for record keeping and for communication support, that this moment hit. I should be using these things for my daughter's care. Bowe is in the point of transitioning from pediatric services to adult services. It's a really challenging position to be in. You have multiple carers. A lot of them are changing. You have a huge amount of information handover, most of which is irrelevant to where you are today, but you have to go through it all over again. And you're also starting to relinquish control over to this person who has been there the entire time, but completely oblivious to what needs to happen before an appointment, during an appointment, after an appointment, coordinating care. And yet you are going to be turning all of this over to them, and they're going to be going through these things. So the real moment for me was actually not that long ago, now a year and a half, where it was, oh my God, I'm not in the driver's seat anymore. I need to be turning this situation over. How do I teach this person to be a better patient? Okay. She said to me one day, Dad, I want to be able to go to my own appointments. I don't want a support worker. I was in a remote part of Australia. We were arranging a support worker to take her to an appointment. Her mom was away on work as well. And, and it was in that moment where it was, okay, I'm going to teach her how to be a good patient. And then it was, wow, there's some amazing technology that we could put together in order to achieve that goal and really see her have control without having to continually regurgitate the information just to be heard. That thing of telling the same story over and over and over again. People don't believe you. You have to say it again. You have to bring in supporting evidence because they didn't believe you. And if they just would have believed you on the first one, if they just would have seen it on that first one, it wouldn't have had so much stress and so much pressure put on that individual or that support network.
And
And
it's
so it
not
was in
even
that moment.
transitioning the care from you as the parent to your child who is turning an adult, but it's also if you're co-parenting or if you have a caregiver, right? Or if you have an elderly parent and you're not there and there are multiple aides that are helping out, or you have siblings,
Absolutely.
multiple siblings that are helping out your mom or dad. There's one record that keeps everything. You shared a story with me about Bowe's birth and when you really realized that the healthcare system needed fixing. How can you walk us through that story that shaped your perspective on the healthcare system?
Yeah. So, as a tech startup, I try not to tell people that they're broken. I still need friends in the system. But I will say that the system is not including the most important part of the system. And so when I think in terms of what's wrong with healthcare and what are the biggest problems in healthcare, I have to say I'm the biggest problem in healthcare. I didn't turn up on time. I didn't turn up at all. I didn't do what a doctor asked me to do. I didn't bring the information that I was given in multiple formats. And so we can look at interoperability, we can look at technology, we can look at services. And there are a lot of challenges that the system is facing. There are a lot of broken pathways. Yes, the system has broken elements to it. But when I think of the incredible doctors, the amazing, amazing, amazing nurses, and I listened to your last episode from there was a nurse who had transitioned to an executive role, and I can see why that would be extremely valuable in an executive position. Hat goes off to all the nurses in the room, especially the ICU and the NICU teams. When you think in terms of what's broken is really that communication with the family, a comprehensive communication structure that gives somebody pathway and and continual engagement with that information, because as soon as you hand somebody a piece of paper, it goes into a pile. Maybe it goes into a folder. Maybe it gets read. Maybe it gets, properly categorized in a library. But most of the time, it goes into a pile, which eventually ends up in a bin without being recalled. I think one of the statistics that you shared earlier is about 80% of information that's turned over in an appointment or in a document gets lost. And that's where things are truly broken, because at the end of the day, the biggest problem in health is the patient not doing what they need, the knock-on effects of not giving the right medication, of not turning up, of not following through with your support. You have more appointments, you have rehospitalization, you have fatality. That's where things are truly broken, is that one-on-one. And I think back to my music career and some of the most successful people that I worked with in the entertainment business. They understand the value of that one-on-one relationship with everything you do. And when I approach things, you think of the number of people with rare diseases. It's very personal, and the support you need is very personal. And so we need to fix that part of the interoperability, is that ability
Yep.
for the amazing clinicians and support network we have to have a better connection with their patient, not just during an appointment, but around the clock and around the calendar.
You named your daughter after David Bowie. Does that rock star energy influence how you approach building Nabu?
Absolutely. I think everything, once you've worked with rock and roll bands, you realize how there is so much function in dysfunction. And the story of how Bowie got her name was very much based on for some reason, when we were in the lead up to her coming into this world, you're given so much horrible information, and you're really challenged with what's being prepared for, what we should be prepared for by way of what's coming next. Not being the typical beautiful, hey, my daughter's in this world, but there's an ICU team and there's all this extra stuff. Still 18 years later, it hits. And her mom kept plugging her ears and singing David Bowie songs for no real apparent reason. It's not like we were listening to Bowie records on the way to the hospital. And you're born, you're in this new environment, you're told that somebody's not going to survive, and you've got rebel turning around in your head. And that's how she got her name.
Yeah.
Wow.
And you definitely need
I
to
think
bring.
it was also during some extremely challenging times where Bowie's a redhead, and somebody who's I'll never forget Dr. Judith Brill from UCLA during one of those really bad days, and Bowie just survived, and she sort of put her hands up and said, "It's always the redheads."
Always the redheads. Well, you're a redhead, so you definitely have to bring that rock star energy. You're Canadian, lived out in California in the entertainment industry forever, and then moved over to Australia. I don't know where
Yes.
Bowie was born, but you've navigated 3 different countries' healthcare systems. What have
Yes.
you noticed were the complexities of each of these individual healthcare systems?
Yes, so Bowie was born in Los Angeles. She spent quite a long time in the intensive care units in the 3 major hospitals in LA, UCLA, Cedars, and Children's, not in that order. And being a Canadian, you're sort of used to the public medicine side of things. And the American side, you've got what and then what happens behind the scenes, especially when you're in a complex situation. And then Australia is a public system in a much smaller country. What I do know is that there are incredible people who are around the world, everywhere, nurses, doctors, rehab specialists, therapists, et cetera, who are really dedicated and really smart and really connected. I've met doctors here who knew our doctors there and talked to them regularly, and I've now connected those dots to the UAE and England and Qatar, and it's amazing. from a systems perspective, and I really put things, especially in the development of Nabu, you've got your human need, you've got your social constraints, the systems that you're governed by, and then you've got the cultural piece of healthcare. From the social perspective, I have a huge amount of respect for the service that we received in California. I have a huge amount of respect for the philanthropy that goes into the children's hospitals there, which really drives innovation. And what we saw when we moved to Australia is that you have amazing people, but you have less resources. We don't have the same levels of philanthropy. We don't have the same levels of let's give it a whirl. I'd never heard before, oh, we can't justify that to the taxpayer. I heard that from a doctor in a hospital
Wow.
here. Um, uh, it's challenging in a smaller country. Uh, on the other side of things, you have a lot of people in California, and they've got to service a lot of individuals. But I think when you're in that rare condition area, you're outside the lanes to the point where the service is just next level. And I have to be honest. I mean, it was amazing for us to see the level of support that we got out of UCLA. However, I do recognize an extremely well-funded hospital in a beautiful part of the world that gets a lot of attention. And so, my heart goes out to everybody that supports them because I know they support a lot of people from around the world. The challenges from,
do
sorry.
you think, Steve, that Bowie would have had such a successful outcome should she had been born in Australia?
Definitely not. I think that, and it's not because of the dedication and the intel. It's really based on the availability. There's a reason why a lot of people go to these major centers around the world to get care for the more complicated cases. And I think that I think that what America throws at everything is really what drives that type of innovation. I think by way of our doctors, we would have had a fighting chance, but by way of our access to innovation, access to medication, um, we just wouldn't have seen it. There's a grit that doesn't exist probably anywhere else in the world.
So, how did your background in brand management and working with celebrities prepare you, or not, for creating a health tech startup?
Crazies
Yes,
everywhere, right? Right, Steve? Crazies everywhere.
the crazy is everywhere. Aerosmith have this great line: "We're all here because we're not all there."
I love
And
that.
the one thing I think you earn out of the entertainment industry is you work around the clock, you work around the work week. Your on day is everyone's off day, and the show goes on. So there's a reputational risk that you have to show up for. You have to take a lot of punches. Your bosses are generally people who were heroed for completely irresponsible behavior, and all of a sudden they're your employer. Right? There's no real HR engine that's governing, and now things have changed. Obviously there's been a lot of social changes and highlighting in that, but there's a lot to be understood around the demands that are put on those people, and of course the people that are working within those motors. So you're just used to getting on with it and learning on the fly. And I think my childhood, I've got a father who's getting towards the end of his life, and I had the opportunity to have a conversation with him last week, one to one, where I got to say, when you left me in these situations, I learned a lot. I can survive anywhere, and that's an important characteristic to have when you are now faced with a completely new situation. Like, I need to understand this environment that I'm in, right? It's like being dropped in the middle of somebody else's production. I need to understand the environment. I need to understand the players on the team. I need to get the information and get an outcome, and I need to be really scrappy. And so, I'm grateful for whatever inputs gave me that gift, but I'm glad I got it, and I hope, one day when I'm judged at the end of my journey, I'm hopeful that nobody will say, you could have done more or should have done more.
It's going to be Scrappy Steve. Scrappy is my favorite word. If somebody calls me Scrappy, I am super psyched. I'm actually hiring right now a social media specialist to help with working healthcare. Hopefully by the time this airs, I've actually hired somebody. But my HR director who's helping, she's like, I need somebody scrappy for you, Meredith. I gave her a high five. I'm like, yes, scrappy. That is what I need.
That should be the job title. And so I think, when you're faced with life and death, that's what it is. And a lot of the people, you look at how a nurse operates during a crash, or a doctor operates during a crash. It's, nothing else matters. Focus on this. If something else is happening, you don't care. You're just focused on that outcome. I think one of the challenging parts of Australia is that people don't like a confrontational conversation because it's seen as really confrontational. If you don't agree with somebody, it's like, oh, hold on a second, can't talk about that, mate. And one thing I like about America is that scrappiness of, we can get on with it, we can get past this. You can really push people to achieve a bigger goal. And I think that in healthcare, you have to have that mentality. You have to be willing to have the hard conversation. You have to be willing to face things that you wouldn't generally face in order to innovate on top of that. You have to do it responsibly. I mean, you hear a lot people say, "Oh, I'm brutally honest," and I think people who say that are generally more interested in being brutal than they are in being honest.
Yeah.
But there is an underlying characteristic, and from listening to your other podcast, I can say you're definitely scrappy because you're challenging the payers, you're challenging the insurance companies, you're challenging the administration to be better, to understand the needs of everybody, and to look at all sides of the problem in order to solve it. And that's where I think that Nabu has really come to be. And I think success is when you open up one door and you don't see a finish line, you see 12 more doors. And I think we opened up one door around a better app for patients and families to retain all of that information. And what we found was 12 more doors of a surgeon saying, "That's incredible the way that you've thought about this. I want it for this." And then we have a community program saying, "Wow, that's amazing. I've got all the information I need. I want it for this." And you then have a family saying, "I don't care about any of that other stuff. If it only does this, I'll pay for it." Right?
So why did you
And
choose,
so we
Steve, let me ask you, why did you choose to focus on the patient as opposed to the provider or the hospital? And I find that intriguing because I want to give more responsibility to the patient as well. I recently had a situation where a patient was denied a complex biologic in which he truly needed, and I had Waris Bakari, who started Claimable, helping with this case. I was involved. And then the patient walked away. And I said, no. Unless you're standing shoulder to shoulder with me, I am not going to fight and help you because you need to be in it just as much as me. But I feel like there's always a lot of finger pointing. Oh, it's the hospital. Oh, it's the clinic.
Yeah.
Oh, it's the provider's responsibility. Why did you decide to make it the patient's responsibility?
there's a few things in there, and I think that what we saw with Bowe's care, and there's a few people. Dr. Anita Newman was one that really. There's a moment that really resonates with me. Bowe's first tracheostomy change, and when you're getting a tracheostomy put in, it's seen as a really monumental step for saving somebody's life. You don't put a hole in somebody's neck for fun, and it's definitely not for luxury. And the first trach change is coming up. Bowe is just out of surgery, and you're looking at this thing and you're trying to understand it. There's a lot of tears. There's a lot of oh no, this is the rest of my life moment, and it's not necessarily the right thing to be thinking of. And Dr. Newman was really big on us understanding this thing and being comfortable with it. And so we're getting ready for the first trach change. She's telling me we've done it on a doll. She's going to demonstrate it for us on her. And we're lined up. We're ready for this moment. We're going to see a hole in our daughter's neck. And she takes her hands up and she says, "Now you have to do it." And you're like, "Okay, done." And then it's, oh, okay. So now that's your responsibility. Now I don't need anyone else to do it. I've got the stigma that's done. I feel better. I've now done this thing. Okay, it's not that bad. And then you go to the next thing and the next thing and the next thing. And we always put into Bowie's head, you have to understand how to take care of. We can't be watching, your stoma site around the clock and yeah, there's some burning there. So you need to revise this. You need to care for it. You need to clean it during the day. It's not that big a deal. And I think one thing I've noticed with Bowie is that every step that we've taken where she's had more confidence, where she's had more understanding and acceptance of these things on her body that are different, we've seen more strength, more resilience in her personality, and we've seen her get taller, get chattier, get less. I'll just move on, and this doesn't define me. I define me. And so I think in terms of our ability to go beyond her defined as disabilities and defined as challenges, where we've been able to just get on with life and just get out there into the community and live to thrive, has been because we've taken responsibility. And when you see families that don't, that they have to go to the hospital to get trach changes, which is common here, who aren't comfortable with these other things, and you sort of see that isolation and the perpetuating problem. And then I think in terms of, well, what happens when I'm not here anymore? Who's going to take care of this if she's not going to be able to dictate and be confident? And so that's where Nabu comes in to say, we need to be more responsible. We've been given this information multiple times. We've been given it in documents. We've had conversations about it. We've sought the consult from all these incredible professionals. But in the middle of the night, when they're not there, we go to Google, and we're told not to go to Google, but it's the middle of the night and you can't call anybody, and you can't be given, you don't know where that document is because it's a piece of paper in a pile of 100 pieces of paper. You're not going to read them all. So I wanted to have a tool that could continually re-engage you with the information you've already been given, so that you don't have to go to the World Wide Web of everything, including beep explicitive here. You can go back to the information that you've been given from your providers at each of these points, so that you can have more confidence in your care and take more responsibility.
Well, I like that.
I think Claimable is amazing.
And yes, Claimable is amazing. And I like what you said about ownership. It's so important, and I share this with the patient. You have to take ownership over your health. We're here to assist you, but we are not pulling the wagon. We will stand
Absolutely.
side by side with you. So in your journey with your daughter, and I know you have two daughters, but Bowie's your oldest, in your journey, how has the care and the work with her mom and the family members and maybe babysitters or support teams helping her been a part of your development process with Nabu? How was it impacted?
It's huge, huge. So Bowie's mom, her name's Monica. She's a great mom. We're not together as a nuclear family. I'm very blessed to be in a supportive co-parenting relationship, but still there's a lot of information that has to go from one place to the other. And you can't rely on a conversation. Somebody's on the fly, somebody's at work. They're not retaining it. And so we use iCal, we use Google Drive. Information goes from one house to the next house, or a provider to somebody, and you rely on everybody knowing everything. It's really, really tricky, and a lot gets lost in that transfer of information. Then you start to involve a support worker, and support worker burnout is really hard. We've seen it in our world, especially when Bowie was more complex and more fragile, and you're turning over these care plans and you're saying, okay, at this time we need this, at this time we need this. You have to remember that I've had multiple years of getting used to these things, and I'm asking somebody who's not medically trained to all of a sudden be comfortable with trachs and G tubes and oxygen lines and needles and all this stuff, but then also to retain that schedule. And that's where things get tricky. You think you said something, you didn't say it. You're just so used to having said it that thought you communicated it properly, I'll put my hand up and say, there are things that I thought I did 100% that I would be convinced that I did, that I did not do.
And I think
I'm not going to.
And I think about what I've done with 3 children, and I was working, my husband was working, my mother-in-law helped me out a lot, my father-in-law would sometimes pick them up, my dad would help. I had a full-time nanny for 11 years, Angela, shout out to Angela, my rock star, and there were so many people involved in caring for my kids, and I would create it in a notes, like you said, in a Google Drive, but what I notice even now, because I now go to doctor's appointments with my father-in-law or with my mother-in-law rather, I am scrolling and scrolling and scrolling and trying to keep this document based on date. And I spend so much time scrolling that it gets muddled and lost. So I just think how amazing to get one platform that everybody can access and give updates. I mean, I literally remember, I always teach this to Mike because Mike doesn't have kids, but I would remember every Sunday I would create a list of schedule for everybody and all the meds that everybody was on and the dinner list and the this, because I travel a lot, and it was so complex and it caused me such stress because I'm replicating this every single week, and what happens when I'm gone?
Right.
So it becomes crazy. So I will get to a question. So when is this available? Because this is really exciting to me.
Well, I think just before we talk about availability, I just want to address that because you bring a really important point up, and a few points. I'll be a relationship coach here between you and Mike. You have 2 people where one person is a real this is what needs to happen, blah, 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 blah. And then you have somebody else in a relationship who might not be that on top of it, or might not be so fastidious with those details, who just feels dictated to. And there's a lot of challenge that happens in that. There's a lot of fighting that happens in that because it's one person who's constantly. I'm not saying that's
to me. It's okay, Steve. I own it. But Mike already claimed the other. Somebody asked me this morning, "Do you like co-hosting with Mike?" I'm like, "Yeah." They're like, "What are the negatives?" I go, "I just sort of still run the show, and anything I say, he says yes."
You're scrappy.
I'm scrappy. You're scrappy too, though. Actually.
Yeah. But Meredith, if you weren't on the couch, he would run his own race, and the outcome would probably not be that much different. Although in health, when you start to miss medication schedules, you start to see that downward spiral. So why somebody is not necessarily why somebody becomes much more bullish and the other person who's more lax starts to take some punches, because that's just the nature of the game, right? You see a negative result and you say, we can't have that because that's just going to create more work for me. So we need to have that one tool that I can say, Mike, download this app, and boom, all of the alarms, all of the alerts, all of the supporting backing information. If you have to give a needle, there's the video, not the video as prescribed by Pfizer, but the video of me doing it on my kid, so that you can see what it's going to be like, what her reactions are going to be like. That single source of information that's so personalized that you can't argue with it. It's just there, and it's amazing. And what I saw when we started this path is you start to, obviously you go down a road and you start to be much more aware of what's out there. And I saw these AI scribes, and I saw these CRMs inside of a doctor's office, and I thought, that's amazing. Why don't I have that? And I started to put together this concept of Nabu, and you go around in the tech startup world, you start to talk to investors and you start to talk to other people. And what I saw was a lot of AI scribes, hundreds of them, no, maybe not hundreds, at least dozens of them, all lined up behind one person, walking past 300 people in the waiting room who actually needed that information, who actually needed that support. And that's where the problem was, me not having access to my information. I've got a dozen letters here that are appointment reminders, where I need to be, when I need to be there, and what admin pieces I need to bring. Not one of them says why. Not one of them re-engages me with the information that my provider spent hours, in fact, spent her whole life building that intel to give to me to have a better outcome. Not one of those letters has any of that information. The next time I walk out of, these are from Helen Woodhead, an endocrinologist who's an amazing individual who's a total technophobe because she spent all of her life on the front lines of pediatric diabetes. Bowe's not diabetic, but we see an endocrinologist. Not one of those letters respects the amount of information we've been given in one appointment. And the next time we'll be re-engaged with that information is 6 to 9 months later, after which we might have not done any of what she said, or most of it for the first few days and then none of it for the next, and so on and so forth. The Chinese telephone game of going around, I shouldn't say that, it's not the Chinese trait, but that game that we used to play of whispering one thing to the next person.
It's called the game of telephone in America, Steve. We call it the game of telephone. But yes, that's exactly right? What I'm thinking about. How many times
that's what Nabu does.
Yeah, and how many times do patients call our clinic and they're like, I'm canceling my appointment? And it's because they don't even know why. It says follow-up, but they don't know what they're following up on. And they actually have a condition in which we need the patient to follow up, or they're on medication where we need to assess how the patient's doing on their medication.
And let me ask you, how many times has the patient said to you, oh, I didn't feel that effect, so I didn't take the pill?
Oh, and then they don't know how long it takes, right? I started a new nasal spray for my allergies, and the doctor, I don't even remember. He said 60 to 90 days. I think that's what he said. Like, I don't even remember, and I'm pretty good with numbers. But I'm like, okay, I'll keep doing it because I don't know. I haven't reached those 60 days yet. But even for somebody like me, especially when you have that older population who needs that additional support. So I see it in so many different uses, and I still need you to tell me how I'm getting it. But I know Mike's like clamoring to ask something.
I'm an entrepreneur myself, and I know that there are a lot of obstacles that you encounter. So what obstacles did you encounter early on with Nabu, taking it from just an idea to a viable product?
Yeah, absolutely. Well, that's a great question. It's if you've done the founder's journey, you realize how hard it is and why people don't talk about that too often. I will say with Nabu, I've been extremely lucky that the providers that we work with were so interested in it, and so my world as a founder prior to this, you sort of butt up against competition, and you butt up against capital raising, and you butt up against all these other these external forces. And I wish one day the hardest part about starting a business will be problem, product, solution, right? That's the easiest part. Then you get governance and shareholders and capital raising and venture capitalists and all of these people that make money based on your success, and some of them even make money based on your failure. And they come in, and you don't know any of those things until later. But with this particular product, when it came to be, the first doctor that saw it said, I want this for all of my patients, right? So I knew there was something there that would have a lot of interest outside of that. Then I put it up on LinkedIn, and the guy that I know in my community, his name's Chris Davies, he reached out to me and said, I want to get together and talk about this new project. Chris is somebody who works in health. He's connected to a lot of leadership. His role is composing teams and recruiting and placing around the world. He introduced me to a few people that were innovators from different hospital groups in Australia, as well as in the UK and in the UAE. And the amount of support and interest that I got was immediate and really widespread. So we knew we had something that, if we went about it the right way, we would get support from the system, so some real authority. But my feeling was, we need to develop something that has no connection to any other technology. I don't rely on you to subscribe or do anything differently than you do in order to give me benefit. I have to be agnostic. And so the challenges around developing a technology, of developing a product and a brand, became simpler because I wasn't looking for interoperability. you've already given me the information. That's the interoperability that I need. I just need a better place to hold it. And fortunately, getting a lot of love out of Google and some technologists that have a huge amount of experience. It's now 2025, so your phone is a scanner. You can ingest and make dynamic any piece of information that you want just by talking to it. So technology easy. Support from the system, that becomes a little bit challenging when you talk about the different types of providers and the different systems that you're trying to connect with by way of either a hospital or an allied health clinic, a therapy center, and so there's issues there. I think the biggest challenge that I have is really in how to maintain a focus on a really specific problem, solve that, and then grow scalably through one country versus another country and another country. Capital raising is always a challenge. I'm stubborn. I don't want VCs. I'd rather people on the front line benefit from a technology. I'm sick and tired of hearing about public money, foundation money going as grants to de-risk, validate, and prove scalable a tech where a private investor wins, and we see this chasm. A foundation then has to go and say, please donate to us, please donate to us. And they say, if it's tax advantage, I will, but otherwise not. So to have that contrast doesn't feel right to me. I'd rather a foundation win. So I've been trying to have that lean startup mentality and only have supporters, shareholders that are on the front lines. So that's been a real big challenge. And fortunately, I've got some amazing people that have come to support financially, to support with intel from leaders in health around the world, from technologists, from impact, and from clinicians, and that's our focus there. And then bringing your product to market. This whole thing started on March 27th, 2024.
So you're really in the new stages of this. The full name is Nabu AI, but we call it
Yes.
Nabu. And so will you have the ability to have the platform or the app listen to the physician appointment or hear the conversation and then download the instructions that the provider gives?
So Nabu comes from the Mesopotamian god of wisdom and literacy who created writing and the rational arts. The name came out of a Google search sitting on the hood of a truck in the middle of the bush in Western Australia, in this sort of, I'd love to know that it was a divine moment. I guess only future will tell us that. But Nabu's got a lot of different components to it, where it's a single source of information for your documents. When you go to an appointment, it's got an appointment flow that talks you through what information you need to share. Why am I with this person? Swipe. Who have I seen recently, and what are the vitals that I need to share? Height, weight, current medication, who I've seen over the last 6 months to a year, any documents related to those appointments. Swipe. All of the family observations and care team questions that need to be addressed in that particular appointment with images and videos. Swipe. Then you can hit start taking notes, and you can either type in your own notes or you can use an ambient listening tool, which will then capture that particular doctor's observations and instructions and create a summary. That summary then gets reviewed and it says, okay, these are our goals. This is what we see. Submit. It's now on record. Your care team now has access to that information. So your partner, now, Mike, you don't have to worry about talking to Meredith about what happened in that appointment. You can just go on, and when Meredith gets home and when she's had her time to sit and digest, you can have a conversation based on the information that everybody has, right? Not, hey, what did you say? Why didn't you ask this? Did you show them that? Oh, could you not find that? It was in the text message. Well, what text message? Scroll, scroll, scroll. Oh, it wasn't on text. It was on WhatsApp. Scroll, scroll. It's not on WhatsApp. It's on Facebook Messenger because It was the nanny that did it, and we're only on Facebook. We've got email, we've got WhatsApp, we've got Facebook, we've got, how many chats and communication methods do you have? And it's a real problem. So to have a single place where people can put their stuff, that there's no debate, there's no question, and then to have that record where everyone can start the conversation from what was the summary that doctor needs me to do? What are our goals for the next appointment? Why do we need to be doing these things? It's all there, and it's not one person's version of the truth versus another. It's a unified, agreed upon truth for that patient, and that's where the outcomes will happen.
So where are you at right now in the product development stage? You're testing right now. When is it going to be available?
So we're going through some pilot programs with some health providers here, and those pilots are really designed around demonstrating an impact on the system. We're testing adherence to a care plan. We're testing attendance, and attendance isn't just showing up. Attendance is being present when you show up and being, having
your medical records.
100%, like having that experience that says to a clinician, right? We want, if you've got 15 minutes with somebody, I don't want 13 and a half of those minutes spent looking for a computer to say, what was that dose? Right? I'm not that, even with interoperability, how much time do you have to go and read all of that and ingest it? So even with this unicorn myth of this great system that has all of your stuff, as a provider, do you really have time? And as a patient, should I really expect that you can look at a computer screen and absorb it all and be able to give me good information? That's completely irresponsible thinking.
So what is your plan? And what is your plan to get it out to market? What are we looking at?
It'll come out this year. And so we've got this pilot going on. We've got this series of pilots going on, but that doesn't change whether it comes out or not. So we've got, now it's August. We anticipate the app being live in the app stores before the end of September. And that's a goal because from the first demonstration, which was the end of September with a neonatologist at the Royal Hospital for Women in Melbourne, September 27th, I wanted it before 1 year. I wanted it live in the app stores. So the goal is, knock on wood, before September 27th, it'll be live in the app store, available for download.
And is that only in Australia, or can you get it in other countries?
The aim is that American App Store will have it, Canadian App Store, the UK, all over the world. So
did you have to do,
iOS and Android.
Steve, did you have to do anything special with HIPAA regulations in the US?
We will be HIPAA and ISO compliant. The interesting part about that is we don't need to be compliant legally with anything. This is your information that you're storing. So it's your email address, it's your Google Drive, it's your mailbox. And when I've been challenged about this in Australia, you'll say, well, you need to have these regulations and you need to have this for a digital platform. I say, okay, can you show me what AusPost went through in order to allow you to put my medical information in the mail? Because my credit cards get stolen, my medical information can get stolen, misdelivered, read by somebody else, resealed. Like it's this idea of information protection is a bit of a fallacy. You think, and when you're the one who needs help and support, you don't really care who knows. You'll make up email addresses to try and get somebody's advice because it's the middle of the night and you're trying to solve a complicated problem for your kid. I sent emails blindly to Japan to get information about the varicella virus. I wasn't worried about that. We are concerned about data privacy, 100%. Every account is encrypted. All of the information is encrypted in both storage as well as in transfer. Security is of the utmost importance. Two-factor authentication. Any member of our team is required to be, one, employed, two-factor authentication on all the developers so that if they access areas of the platform that they're not supposed to access, everybody gets locked out. There's a lot of checks and balances there, but from a compliance perspective, this is your information. You need a tool to help you navigate the system.
Is there going to be,
for America, for us, are the units and all that stuff.
Is there going to be a cost associated with this?
It will be. Like everything, there's a cost to run it and develop it, and it'll be a subscription rate. It'll be on a tiered plan. We're sorting out what those tiers look like now. There will be opportunities for once I can go to a clinic and say a Nabu user will cost you X less per year. I mean, you think somebody doesn't show up, that's going to cost you minimum $80, right? If you're not showing up to a multidisciplinary clinic like an endocrine clinic, that's going to cost the hospital 500 plus for not showing up, right? One no show, and you've paid for this for 2 3 years easily, easily. So we're right now we're demonstrating that so that we can have that platform for clinics and for hospitals to be able to offer it out. But like I've witnessed with families who are in our position, you solve one of these problems, and for a family, that's worth 15 to $20 a month.
Oh,
You
yeah.
you give me a better way to transfer information to an incoming support worker for my mom, in Australia, and we're sorting this out in other parts of the world. If you onboard a support worker, it does a police check on them. It does a driver's license check. It does a working with children's check, a working with vulnerable populations check, and it does that on a weekly basis. So you know that that person is a good person. There is no flags on them. There's no risk of a predator coming into your house, and that's another big important factor. Safety, assurance, quality, all of that stuff.
And Steve, you are changing the healthcare system from the inside. But I will ask you, because I would be remiss not to ask my lovely final question. But if you could create one change within our American healthcare system as a former person who lived within the US, what would that be? Since we beat Canada and Australia, which you have shared. But if you could create one change within our American healthcare system, what would it be?
Support for the primary care. I think that the statistic, and it's typically mom, although there are a lot of dads out there, and my hat goes off to anybody who's supporting somebody with a disability or somebody with a chronic illness. It's usually that first person that's taking the responsibility that has the worst outcome. And obviously mental health is a big part of that. And you think of the isolation, you think of the loneliness. We've come to this point in society. You ask somebody how you doing. That's not how you doing. That's, hey.
Of course it is.
You okay? And Americans are, English are great at it. You have to say, "You all right? You okay?" You say it 3 times, and none of them mean, "Are you okay?" How are you? It's just, but if you're in that position of being a primary care, you are often left alone, and the statistics on the mental health challenges around suicide, around calling for help in distress, around not being able to be supported, around the loss of work, the loss of social, the loss of self. If we could solve that, and that's a huge burden, and that's a big part of our focus at Nabu, and it's the one that's not necessarily as quantifiable in the short term, but for for my purposes, if somebody comes back and says, who's a primary care, who's a mom, who says, I've had a better week because of this. I have a better relationship with my partner because of this, because we don't have so many arguments over who did what. We don't have so many arguments over what was that reaction, what did that person say. If we can support the mental health of the primary care of typically it's the mom, that's the one thing I'd like to fix.
Steve, thank you. Thank you for sharing this. Thank you for creating something. You're going to cross the chasm with this. I know you will. And I'm very excited. I will check it out. Looking forward to this for sure.
Me too.
Thank you. Yeah, we're going to be available for pilot program where anybody who wants to take a stab and follow nabucares.ai, the website, follow us on LinkedIn. There'll be opportunities for people to engage with us. I'm super grateful for my supporters, my colleagues now in the family, Kaylee Dayton, who's an acute care specialist. She's got the Awake and Walking ICU program. She's a fan of your podcast.
Good.
Chris Lloyd at Kaiser Permanente, Arlen Cohn, who's an amazing support. Who's been an eye-opening supporter for me from the early days. He's very arguably the most important person, not for my past, but for my future. and they've provided a lot of intel, and they're all in the American system.
Well, we will be promoting the heck out of this. Everybody needs to go onto LinkedIn because you're all over LinkedIn. Everyone needs to search out Nabu. I love the fact that patients need to take over ownership. I love this solution because I personally am really tired of everybody pointing the fingers to doctors or quote MBAs, right? The admin team or hospitals or clinics. Like, patients need to step up. So I really appreciate you creating that solution. So to everyone listening.
Thank you.
Thank you. To everyone listening.
And thank you both for the work that you do.
Thanks.
Thank you.
I'm going to do it. Third time's a charm. To everyone listening, the full video of this episode is now live on YouTube. Just search Working Healthcare and hit subscribe so you don't miss future interviews, short clips, and behind-the-scenes moments. And if you've got a question, an episode idea, or someone you think that we should feature, drop me a line at meredithhirsh.com.
And if this conversation hit home for you or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post it on social. You can follow us at Working Healthcare on Instagram, Facebook, and YouTube. Meredith and I are also available on LinkedIn. That's where we keep the conversation going between episodes. The more voices we bring into this space, the more momentum we build. Because change doesn't start with a policy, it starts with a conversation, a real one like this.
New episodes drop every Tuesday. Subscribe and don't miss what's next, because you can't fix U.S. healthcare until you understand how it works. I'm Meredith Hirsh.
And I'm Mike Chavez.
Tune in weekly as we explore the inner workings of healthcare.